Hello and welcome back. This is Neola from Neeve Institute. Today I'm here to discuss about various phrases that you can use during the speaking role play, and I'm sure this will help you a lot. So let's get started with the video. So first of all, it's the introduction where people get confused to what to speak about, how to introduce themselves, and how to go about in asking questions with the patient. So in the introduction, it can be like, the setting can be different. It can be a hospital setting, or it can be a medical, outpatient setting, or it can also be a home visit. So if it's a hospital setting and if you already know the patient, how do you introduce yourself and how do you speak to the patient? So this is regarding that. So since I told you that you know the patient already, so you already know his name, right? So how do you speak to them? Good morning, Mr. Wilson. So depending on the time of the day, you can say good morning, good afternoon. Okay, so good morning, Mr. Wilson. So then how you introduce yourself? I'm Sarah, one of the registered nurses working in this ward. Yeah, or one of the registered nurses working in this hospital. I've been assigned for your care today. You can say that, I've been assigned for your care today, or you can also say, I'm here to take care of you today. Yeah, or I'm in charge for your care today. You can say this as well. And then speak about his overall general condition, how he's feeling. So how are you feeling today? Or if it's mentioned in the role play card that the person seems a bit confused or seems worried or anxious, so then you can use that in your sentence. So you seem a little anxious today. May I know what is bothering you? Or you can say you seem a little concerned. You look concerned. You appear to be anxious today. So may I know what is the reason behind your concern, or what is the reason behind your anxiety? So this is how you go about. And what if it is a medical clinic setting? So you can say, good morning, please have a seat. Please sit down. I'm Sarah, one of the registered nurses working in this clinic. Could you just tell me your name for my documentation purpose? Okay. So once the person says his name, you can say, all right, Mr. Wilson, how may I help you? Or you can also say, what brings you here today? Okay, so this is how you go about when it is a medical clinic setting or an outpatient department. And during the home visit, you can say, good morning, I'm Sarah, one of the community nurses working in this area. Am I talking to Mr. Wilson, or is Mr. Wilson available to talk? Or you can also say, may I talk to Mr. Wilson? And since it's a home visit, the GP might have requested you to visit them. So you can just say, your GP has requested me to get in touch with you, or you can say, your GP has requested me to visit you and provide information on the purpose of the visit. You can include here. So provide information on administration of insulin, or provide information on various ways to alleviate your symptoms, or various ways to bring about changes in your lifestyle for management of your BP. Then is this the right time to speak to you? So you need to ask them the permission, whether it is the right time to speak to them or not. Okay, so is this the right time to speak to you, or I hope this is the right time to speak to you? So this is how you go about. So once the introduction is done, it's your part where you have to collect information from the patient. So how do you collect it? So could you please give me a little more information, or could you please tell me a little more about what's bothering you, or what is causing you to get anxious, or what's causing anxiety in you, all these things. And then for my better understanding, or to understand more clearly, I would like to ask you some questions regarding your general health. Is that okay, or would that be okay? Could you please describe your symptoms for me? Or could you speak more in detail about your symptoms, or about the things that you've been experiencing lately? And then you can say, I'm afraid I may have to ask personal questions, so may I proceed? Or do you mind? Yes. Then once all the information is gathered, what do you have to say? Thank you for sharing these information. It really helped me to get a better understanding of your condition. All right. So you have to know one thing, that whenever you collect information or you ask permission from the patient, you always have to thank them. Okay. So this is one thing that you have to remember. Next is providing information. So how do you provide information? Don't worry, I'm here to explain, or don't feel so anxious or worried about it. I will explain everything to you. So when you're speaking about something, like, there are a lot of points that you have to speak about. So you can go about like this: firstly, secondly, thirdly, and finally. Okay. And then you can also use some words like moreover, even though, although, yeah, apart from this, or in addition to this. Please don't forget to, or please remember to, or please keep in mind to. So all these things we can make use of. Next is the assessment. So if you have to, make an assessment on the patient, so how do you ask for it? So will it be okay if I assess you? Or do you mind if I assess you? I would like to do an assessment on you. Would that be okay? Okay, that is how you ask. So once the assessment is done, how do you respond? So based on my assessment findings, or based on my examination, or if the blood tests have been done and the reports are available in front of you, then you can say the blood test reports reveal or indicate that you have so and so problem. Yeah, your X-ray or CT scan reveals or shows that you have pneumonia. Okay, so this is how you go about. Then checking patient's level of understanding. So how do you check it? So have you understood so far, or are you with me? Is it clear to you, or am I clear to you? Do you have any concern, or do you have any other concern, any more concern? Is there anything you want to ask or share with me? Is there anything else that bothers you? Do you feel that you're a lot less worried or anxious after having a conversation with me? So this is something that you want to understand, whether the person's anxiety has been reduced or not. So is there anything you want me to clarify, or is there anything you want me to explain more? Okay. Are you able to follow me, or are you with me? Or do you get my point? How does that sound to you, or how you feel about it? Or how does that seem to you? And then if the person has been asking you some questions, you can also say, that's a really good question. So surely I'll help you with that. And also, if you have to ask them if they'll be able to follow your instructions or not. So how would you ask it? Will you be able to do what I suggested, or do you think you can do it? So this is how you check the patient's level of understanding. Next is empathy. So as a nurse, you always have to be an empathetic listener, and you have to provide empathy to the patient. So how do you express empathy while speaking? So you can say, I know it's challenging for you, but I'm sure you'll be able to manage it. I can really understand your concern. I know how difficult it can get. I can sense it must be hard for you. It's quite reasonable to feel this way. I'm sure everyone in your situation would feel the same. If I were you, I would react the same, so I totally understand how it feels. I'm extremely sorry to hear this, but don't worry, everything will get better. I totally get that, and it's completely normal to feel this way. Yeah. So this is how you express empathy to the patient. Next is reassurance. So how do you reassure the patient? There seems nothing to be overly concerned about it. Let me reassure you that all your concerns or worries will be allayed. Allayed means reduced or relieved. Okay, so allayed if you follow my instructions or advice. Most of the patients experience the same symptoms like you do. So we are here to care or provide assistance for you. You can be rest assured that you're safe in our hands. Don't worry too much about your condition. There's always a way to get over it, or to get over your problems, and we are here to help you out in any manner we can. So this is how you reassure the patient. Next, how do you conclude your speaking? So if you follow my advice, or if you follow your doctor's instructions, and if you take your medications regularly, or if you're compliant with your medications, you will definitely be able to recover or recuperate soon from your disease. Okay, thanks for cooperating with me. I wish you a speedy recovery. Thanks for accepting my suggestions. I hope you'll get better. Thank you for your time, Mr. Wilson. Have a nice day. Please do not hesitate to call us if you require any assistance. Thanks for visiting. So this is how you conclude your speaking. All right. So if you have any more doubts, you can feel free to comment on this section below, and I will upload a few more videos on the speaking tips, speaking and the vocabularies that you require to learn. Also on various tips to study reading, listening, as well as writing. So thank you for your time. And if you really like this video, please like, share, and subscribe to my channel for more videos. So Neeve Institute provides classes for DHA, HARD, MOH, and other prometric exams, also for IELTS and OET. And we also provide assistance with data flow services, exam bookings, NMC registration, and good standing as well. So we have online classes for our students, and the timings are flexible enough based on your duty timings, and all the study materials will be provided for your preparation. If you want to join us, then you can feel free to contact us on WhatsApp, as well as you can call us on 84313 the number given below. And you can also contact us through Gmail, and our ID is neeveinstitute@gmail.com. So thanks again, and I wish to see you in the next video. Till then, take care, and bye-bye.